who's the bariatric coordinator. Welcome, and if you don't have a calendar, there are some over on that table that will give you the time and dates for the rest of the year. We're going to have what our normal format is: a speaker for the first 30 minutes, and then we'll get into, well, I already put you in small groups, so we'll have small group discussions afterwards, and we might consolidate a few people so that we just have two groups, but we'll see, as long as you're comfortable in your groups. Katie Hiller, who is our clinical reviewer and maintains our database for the quality program with the American College of Surgeons, is speaking today, and she's talking about sleep. And if you haven't heard about how crucial sleep is and how it's connected with your weight, I think you'll find this really interesting, especially in today's society. I think this is probably something we all need to hear about. So I'm going to let Katie take over, and then afterwards, if you want to, anybody who wants to get vitamins, you can come over and get those from Laura and Annie, and then the rest of us will go into small groups. Okay?
Thank you. Can everybody hear me okay? Okay, I don't usually wear a microphone, so this is a little weird for me. So yeah, we're going to talk about sleep and why it's an essential element for weight management. I don't know if any of you go see Whitney, our nurse practitioner. I think the PAs, I think you probably asked this as well, but there's 4 real important things she asks you. How much protein are you getting in a day? How much fluid are you getting in a day? How much exercise are you getting in a day? And how much are you sleeping? It's that important. We're going to learn about what happens when we sleep, why it's good for us. We're going to talk about why we don't get enough sleep, what's going on in our lives. We're going to talk about how sleep deprivation, or lack of sleep or not enough sleep, how that affects us, our brain, our body, our emotions. And then we're going to also talk about how we can maybe sleep better. Sleep more, but also better. All right? That's the plan. So how much sleep should we get? According to the National Sleep Foundation, adults should get between 7 and 9 hours of uninterrupted sleep a night. Who gets that? Nice. That's awesome. But more than 35% of Americans are sleep deprived, with the average adult sleeping only 6.5 hours a night. They do say kind of the magic number would be 7.5 hours of uninterrupted good sleep a night. So that should be our goal when we leave here. Not sleep on the way home, but when you get home, sleep at least 7.5 hours tonight. Why don't we get enough sleep? These are pretty easy. We're a very busy society. Sleep's a low priority. We have lots to do in our lives nowadays. We take care of lots of people, lots of things, our jobs, our families. We can always sleep later. And we've all said this, possibly, or heard this. I'll just sleep when I'm dead. But constantly feeling burned out is no way to live. One of the clearest reasons to sleep is so you can actually thrive instead of just walking around like a zombie and existing. Correct? We can all agree on that. All right. Number 2, our lives are filled with technology and screen time. We never shut things off being Americans. People text us, email us. We've got to send another email. We've got to text them back. We want to look something up because we don't know the answer. We're constantly looking at our technology. It's also shown that the blue screen, or the blue light that we get from our laptops, suppresses the production of melatonin, which is our body's natural sleep hormone. So it counterbalances. If you're laying in bed and working on your laptop, you're not producing what your body actually wants to produce to help you sleep. Number 3, sleep disorders. It's estimated that 50 to 70 million Americans suffer from sleep disorders that compromise their quality of life. Sleep apnea is a big one. When breathing's interrupted several times during the night, that's sleep apnea. A lot of people don't even realize that they have sleep apnea, that they're waking up multiple times. A lot of people do realize that. It can be from being overweight, or it can also be anatomy problems that kind of close off the airway. which is why it's really important that if you were diagnosed with sleep apnea and use a CPAP machine, maybe starting with surgery, when you lose your weight, it's really important to be retested to make sure that the weight loss is actually taking care of the sleep apnea, and that it's not something that you had for a long time just because of the way your anatomy is. So we want to make sure that you're sleeping really well. Insomnia, difficulty falling asleep, and also difficulty staying asleep. That can be caused by stress, certain illnesses like depression, certain medications, or even alcohol. I know a lot of people think that, oh, a glass of wine or something before I go to sleep is going to help me go to sleep and stay asleep. Actually, no, it doesn't. It's proven that it might help you fall asleep because it might relax you a little bit, but it really doesn't help you stay asleep, so it's kind of counteractive. Restless leg syndrome. Does anybody have restless leg syndrome? Yes, me too. It's uncomfortable or unpleasant sensation in the legs with an irresistible urge to get up, move around, shake your legs, rub them, anything you can do to make it stop, make the creepy crawly stop. That can be caused by medications, deficiencies. If you're deficient in certain vitamins, go see Laura, go see Amy. You need to make sure that your vitamin levels are safe and adequate. That can also cause restless leg syndrome. Also, other neurological illnesses can cause that. Pain. When you're uncomfortable, it's hard to get comfortable enough to fall asleep, but pain can be the main reason that someone wakes up multiple times a night, and this results in a decrease in sleep quantity as well as quality. And on the flip side, sleep deprivation can lower your pain threshold, causing you to feel pain more. Can lower your pain threshold and pain tolerance, making existing pain feel worse. Also, we live, once again, in a busy society. We all work a lot. Our work schedules can get in the way of normal sleep. People working shift work, meaning the night shift or evening shift, or just odd hours. They can really play with our circadian rhythm, which is our body's natural. You wake up when the sun comes up, and you go to sleep when the sun goes down. We interfere with that a lot. So it's not just about quantity, meaning how many hours we need to get to sleep every night. It's about quality of sleep. Our body goes through sleep cycles. We go through 5 cycles. I'll show you that in a second. But it's a pattern. And we go through the sleep cycle 3 to 4 times a night, and each cycle lasts 90 to 120 minutes. It's between rapid eye movement and non-rapid eye movement. Rapid eye movement is when we're dreaming. It's our deepest sleep, and that's really when it's our best sleep, when our body is doing all of its healing and all the good things that happen when we sleep. So we really don't want to interrupt our sleep because we start over in the cycle. We spend 75% of the night in the non-rapid eye movement sleep and 25% in the REM sleep. So sleep is like nutrition for the brain. We need it. So we can picture the sleep cycle. So we go through the 5 different stages. It's hard to see on there. On your handout, it's probably pretty hard to see too because it's probably pretty little. But lots of things happen, especially, am I okay walking? Okay. Over here in the deeper sleep, muscles relax, tissues and organs repair. Your body's immobile. This is when we dream. Our body actually is kind of frozen. But your brain is active. Energy is provided to the brain and body to help support you during the day. It's when everything, all the restorative things happen. But interrupting any of the stages disrupts the cycle, and the cycle starts over. So when we start over, we don't get to that deep sleep as often. So we want to get to sleep and stay asleep and have good quality of sleep. So when we sleep, tissue growth and repair happens, muscle repair and healing, memory consolidation. So all the things that happen during the day, when we sleep, our brain actually then files that all away, puts all of our memories where they're supposed to be. If we don't sleep well, some of our memories that's not all happening. So you don't have as much clear thoughts. Release of hormones regulating growth and appetite. Your energy is restored, so you have a healthier immune system, which is fantastic. Your blood pressure decreases, reducing stress on the heart and vessels. Now, what happens when we are sleep deprived or we don't have those good 7.5 quality uninterrupted hours of sleep? Hormones get out of whack. Our ghrelin goes up, our leptin goes down, and our cortisol goes up. Why is that bad? Well, your ghrelin is your hunger hormone, your leptin is your satiety or satisfaction or fullness hormone, and cortisol is your stress hormone. So your hunger goes up, you're not satisfied with what you're eating, and you crave foods high in sugar and fat. And when your cortisol level is up, we actually store our energy or food as fat instead of using it for our good energy. Our willpower is decreased when we're tired or sleep deprived, which means it's harder to make those good choices. Our insulin resistance happens. And when we're resistant to insulin, our body wants to store energy as fat. You also have a higher risk for diabetes when you have insulin resistance. You're fatigued, you're tired. That's pretty obvious. But it means that you want to skip going to the gym or you want to skip doing your exercise for the day because you're tired. Your metabolism also decreases. So what can this all lead to? This is fun. Weight gain. My kids had to help me do that one, but that was kind of fun. But, getting good sleep might not help you lose weight, but it sure is going to help you not gain weight, okay? So what can sleep do for weight control? It can help you fight the cravings and make healthy choices, help maintain resting metabolic rate. So that's just our basic metabolism to keep our bodies going. And we want to keep that nice and healthy so that our bodies are constantly working as a good machine, right? We want to keep that nice and healthy. Can enhance our physical activity, make us want to get up and do more, help maintain a healthy weight. This could help us be happier, healthier. Now, if I haven't sold you on why you should sleep more or sleep better, some research that I found thought was kind of interesting. The University of Chicago researchers probably found that within just 4 days of being sleep deprived, insulin sensitivity dropped by more than 30%. So that means people were storing more fat and led to more diabetes. The American Journal of Epidemiology found that women who are sleep deprived are 33% more likely to gain 33 pounds over the next 16 years. So 2 pounds a year doesn't sound like a whole lot, but that sure adds up over the years. Research published in the Annals of Internal Medicine cited that those on a sleep-deprived diet experienced a 55% reduction in fat loss compared to their well-rested counterparts, which means that when the body's well-rested, weight loss from fat is increased, which is what we all want to do. So not sleeping enough can reduce and undo the benefits of dieting, which is not what we want to do. So how can we sleep better? I got a few of these off of WebMD, and these were what they said. So shut down your computer, cell phone, and TV at least an hour before you go to bed. Kind of turn off all your technology. Think relaxation and release rather than work or entertainment. Create a bedtime ritual. It's not the time to tackle big issues. Instead, take a warm bath, meditate, or read. Stick to a schedule. I think this one's a hard one. Waking up and going to bed at the same time every day, even on the weekends. I think that's really important, but I think that's probably the hardest one for all of us to do. Watch what and when you eat. Avoid eating heavy meals and alcohol close to bedtime, which may cause heartburn and make it hard to fall asleep. Avoid soda, tea, coffee, and chocolate after 2 p.m. Caffeine can stay in your system for 5 to 6 hours. Turn out the lights. It's your body's natural way to know that it's sleep time. Darkness cues your body to release the natural sleep hormone, melatonin, while light suppresses it. And get 30 minutes of sunlight, preferably in the morning. That seems to help. So other tips, other things that I read and thought of, things that can help you sleep are Obviously, if you have sleep apnea, using your CPAP machine is going to help you sleep better. And losing weight can also help with the sleep apnea. Lavender is a really great herb. Is lavender an herb? What is lavender?
Flower.
A flower. The scent of lavender releases things, helps you relax. Warm bath helps you relax. Melatonin. You can buy melatonin over the counter. A lot of people like that. A lot of people, it helps them fall asleep. A lot of people, it helps them stay asleep. Magnesium, or magnesium, calcium, zinc, as Chris likes to use, especially for restless leg syndrome. Magnesium is a natural muscle relaxer, so it helps everything just kind of relax. Or if you're truly having problems with insomnia or really having problems with sleeping, going to see your doctor and having him or her prescribe some sleep medications. This was an interesting one that I read. It said wearing socks and having a warmer extremity, cooler core was better for sleep. And you're shaking your head.
Yeah.
You wear socks to bed?
Yeah.
Interesting.
That I couldn't sleep unless my feet were warm.
Yeah. Reading a true book instead of reading on something that's got a blue screen instead of any screen time. B vitamins seem to help, and they're needed to synthesize serotonin, which is a great hormone that helps with lots of wonderful relaxation, depression, all that good stuff. Yoga, meditation, Tai Chi, relaxation exercises. Shouldn't do too much exercise too close to bed. That seems to disrupt being able to fall asleep as well, but relaxation, meditation, that kind of those exercises. But exercising regularly is shown to really help you relax and be able to sleep better. Write your thoughts down instead of going over them in your head in bed. I know I lay in bed and think, oh, tomorrow I got to remember to do this, this, and this, and I have to remember to tell her this and this. If I sit there and I worry that I'm going to forget it, just get up and take a notepad next to my bed, write it down. I can forget about it. Hopefully remember to grab the notepad in the morning. So, a third of our lives that we spend sleeping is far from being unproductive, plays a direct role in how full, energetic, and successful the other 2/3 of our lives can be. Like that puppy, which my